Hi guys, my name is Caitlin. I'm currently in the FNP track. I chose this track because my background in nursing has been in neurology. I work at a level one trauma center in Worcester, Massachusetts on the accredited stroke floor. So I see a lot of stroke patients and general neurology patients. And in this population, there's a lot of deficits in preventative health, and I see a lot of patients that diseases and complications could have been prevented if they had adequate primary care. So that's kind of what sparked my interest in primary care. Um, I envision my entry into my dream job into an advanced practice registered nurse in hopefully a primary care physician's position. At a primary care office that has adequate support. Hopefully has some good mentors because I feel like as much as you learn in graduate school and in your clinicals, there is so much that goes on with like insurance and coding and just so many different things that go into this that it's important to have like an adequate support system and mentor within the position, especially for your first job. One question that I'm hoping that this course will answer that I saw when I did shadow a nurse practitioner for about a week before I applied to this program was all of the different um, coding and billing that goes into it, and that it's not just like as simple as making a diagnosis and recommending a medication, that sometimes insurance plays a bigger role into our decisions than we would like. And even just things when she was auditing charts of her employees in the way that they have to code based on if it's a acute illness that they just discovered or something new that they just discovered, or if it was a chronic condition that they had already discovered in the past and they were just managing the chronic conditions and all the different codes that went along with that, which I wasn't really aware of before I had seen it that shadow thing time. Um, and then one personal information about myself is that I am currently expecting and I am due July 27th, so right in the middle of this course. So wish me luck.